Hello, Assalamu alaikum. Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. The area of interest is the upper and the lower arch for implant placement. Now, implant placement in the upper arch is absolutely difficult, especially because of the limited bone quantity that we have. Starting with the upper right posterior most implant, as you can very clearly see here, we've got this is a deeply placed implant. We have to go approximately 5 millimeters deep, or 5 millimeters of alveoloplasty will need to be done in order to place an implant, because we just have 5 millimeters of ridge width with 10 millimeters of height. Moving to the upper right lateral canine region implant. This is the lateral and central region. As you can see, we have to go in slightly deeper with 5 millimeters of ridge width and approximately 10 millimeters of height. Moving to the upper left lateral canine region, here you can see we've got a ridge width of approximately 6 millimeters. We've tried our best to place this implant as appropriately as we can, but we've got limited bone in this region. This implant is going to be slightly difficult to place, especially because of its limited bone in the region. This is the upper left posterior most implant, and here also you can see we've got a ridge width of approximately 5 millimeters and a ridge height of approximately 10 millimeters. In the lowers, you will have to do 3 millimeters of alveoplasty to go 5 millimeters deep with 12 millimeters of ridge width and height, and then we can place a 3.8 millimeter implant. Here also, extremely poor quality bone and very limited ridge width. This is something that the doctor needs to keep in mind prior to implant placement. 6 millimeters here, approximately 10 millimeters of height.